We'll move on to the next speaker. That's none other than Dr. Vaibhav Sethi, who's going to be speaking on diabetic retinopathy. How common is diabetes in South Africa? Is becoming a pandemic like India? So we need to ban sugar. And I find that most people who are diabetics tend to be very bitter about it, though it's a sweet disease, you know. So, and we would like to also accept the presence of Dr. Sahiba Sethi, who has joined us. She runs on the principle of better late than never. So Dr. Vaibhav Sethi has done his residency at the Arvind Eye Hospital and then his super specialization fellowship at Vidyaretta at the LV Prasad Eye Institute. And right after that, he was flown to South Africa to operate.
Yes, so diabetic retinopathy is a main problem, especially in the Indian scenario, because it has been documented in 2019 that around 77 million people are diabetic, and it's going to cross 100 million by 2030. And the national prevalence of diabetic retinopathy is around 8.9% across the age group of 20 to 79, the productive years of the age. So 1 in every 11 adults in India is affected in diabetes. And the main problem is that a high proportion of these are undiagnosed. Around 57%, that was this consensus in 2019. So amongst the diagnosed as well, around half of the patients are poorly controlled diabetics. So asymptomatic diabetic retinopathy disease is very, very common, 90 to 95%, which is a huge amount now. So because the symptoms come in when the retinopathy is advanced or when there is involvement of the central macula, and that is when the patient presents to you. And that's the main problem. So you have to actively search for it and screen for it. That's why DR screening is so important. So there are various guidelines, the All India Society guidelines, the Retina Society of India guidelines, the Queen Elizabeth Trust, and the WHO guidelines. But what they tell us is that the screening, basically the factors which promote success of the screening. Equitable screening with widespread access to laser treatment and trained staff, including administrative staff, is very, very important. Initiating and having local screening programs that are scaled up gradually is an important stepwise manner of having success in such programs. And screening offered at times and locations that meet the needs of the patient is very important. So you must cater to the demands of the population you are screening. And there should be centralized registers for eligible people, and very, very important to have constant updates. So it's important that you have a buy-in from the healthcare professionals, the patients and the family. So it has to be a teamwork, and everybody has to be part of the screening program. It never can be that a hospital wants to do the screening. If the patient is not accepting it, then it's of no value. So accurate data collection is very important. Then only you can know what exactly is the prevalence in your local areas. And very, very important, you must cater to patients who do not attend and who are lost to follow-up. Try to manage those patients because it's asymptomatic. So patients do not turn up. They don't see the need for it. So it's important that there are some challenges and barriers, that is decentralized healthcare or mainly private insurance-based healthcare have low success. Eligible population is basically increasing every year. The diabetes are increasing, so the budget also is a constraint to do DR screening. And majority of patients are asymptomatic, 90%. So in such cases, it's very difficult to convince a patient to get a screening done, even by the physician. Even they're not doing the screening. So that's also a major issue. So they know the patient is diabetic. Patient understands, but they don't get the basic checkups done. So less than 85% uptake of annual eye screening. So even once a year screening of a diabetic patient is uptake is less than 85%. That's a very, very high proportion of patients. So again, they don't attend DR screening programs, and just isolated DR screening without management of diabetes or having a specialist ophthalmologist providing services. So basically, you have to provide screening which also followed by management and patient engagement. So you have a complete cycle. So that is when you have success in this program, because patient maybe is lost to follow up even though he knows that he has diabetic retinopathy. So systematic telescreening is very important because it's cost effective. Patient doesn't have to travel all the way to a doctor. He can just be photographed. His retina can be photographed and sent to the doctor through cloud or other modalities. And targeted screening, including the private sector, is very, very important. task shifting approach in India is required because there are lack of ophthalmologists in the rural areas. You'll find many of them that are there in the cities, but you will not find them in tier 3 areas or rural district levels where there's a need. So non-physician graders that are trained, and those are very important, like nurses, optometrists who are present in the rural areas, and they can take proper pictures and send it to the local ophthalmologists in the cities. So establishing screening pathways is very important, and quality measures, quality assurance, and quality control is of utmost importance in having a good DR screening program. So the All India Society tells us that at least 80% sensitivity, 95% specificity, and less than 5% technical failure rates is recommended in a DR screening program. So the ophthalmologist, the optometrist, the assistant, the eye technician, all must be certified graders when you're doing a screening program. It's also important in India, there's something called ASHA workers that are present in the rural community areas, the village areas. So they are incentivized, and if you incentivize them, they take care of the cataract screening program as well, because they go door to door, they make sure that the patients are screened, and they get incentive per patient that is sent and gets the surgery done. The same way, diabetic retinopathy can also be involved in such a way to track and monitor these patients through the ASHA workers. And monitoring of and evaluation of screening pathway is very important. Having constant feedback is also important. So the key steps would be identifying the eligible population, proper SOPs to avoid mis-screening, and referral threshold. So you should know when to refer, when not to refer, and what to advise the patient also. These are important things. So very, very important, as has been told by the previous speakers, is health education is the most important, because they can develop diabetes in later on, so they must know that they must get an annual checkup done. That's important. So distributing flyers and other important animated videos are also very, very important through social media. And finally, it's important to build trust in the system so that the doctor and the patient have trust in each other for this program to be successful. So very, very important to involve the private sector, because just the public partnership in India is not going to solve the problem with DR screening, because you require NGOs and you require private sector to be under the same roof so that you can do good monitoring and have a successful program. So that's all. Thank you so much. Thank you.